We can think of this not as an open door between the nose and the brain, but rather a screen door, which lets through the drugs that we want, but still protects the brain from the things we don't want. There is difficulty in getting therapeutics to treat diseases of the central nervous system to the brain because of something called the blood-brain barrier. The blood-brain barrier is a wall between the outside world and the brain and central nervous system, which normally protects the brain from things like toxins and infection. However, when we try to treat diseases of the brain and central nervous system, this barrier blocks up to 99% of all potential drugs from getting in. There have been many ways to try to get around this barrier. Most involve invasive methods. These are things like putting catheters or implants into the brain so that drugs can be directly delivered. When they are implanted, they can cause trauma to the brain and they can cause infection. An alternative method really needs to be designed. Coming from a world of endoscopic skull-base surgery, our team over many years has worked to close holes between the nose and the brain, which we create while taking out brain tumors through the nose. In doing so, we are creating a window between the nose and brain, and then patching that with a piece of the nasal lining, which we call nasal mucosa. The nasal lining is an active immunologic organ that serves to protect the mucosa, and in this case the brain, from infection. We know from other studies that the nasal mucosa is up to 1,000 times more permeable to drugs than the blood-brain barrier. Could we use the surgical techniques that we use to repair these windows in the skull base to deliver drugs to the brain? In order to test this, we started with animal models in mouse and rat, and actually found that we were able to deliver molecules up to 1,000 times those that would be permitted by the blood-brain barrier themselves. At this point, we have tested both proteins and something called oligonucleotides, or nucleic acids, which are similar to what our DNA is made of. And we have found that both of these types of therapeutics are able to not only get into the brain through these mucosal graft techniques, but are also able to have a therapeutic effect. And in fact, we have shown that they have been able to prevent the development of Parkinson's disease in these models. This type of approach really represents a platform technique because these mucosal grafts are permeable to virtually any drug for virtually any disease of the central nervous system. We will be continuing to work on these projects and trying to address a variety of conditions, including neurodegenerative disorders, tumors of the central nervous system, and even other diseases as well.